Hi everyone, on behalf of the ESDR board, welcome to this new edition of the ESDR Kitchen webinars. I'm Julien Seneschal, dermatologist working in Bordeaux University. Today is a recipe book where new techniques for research dermatology are presented. And now I give the word to my co-chair, Professor Enikö Sonkoly, to introduce our today guest speaker, Dr. Janin Edelkamp, for this recipe book, please.
Thank you very much. My name is Enikö Sonkoly, and I'm lecturer at Uppsala University. And it is my pleasure to introduce to you today's speaker, Dr. Janin Edelkamp, who is going to talk about hair research today. So Dr. Janin Edelkamp is the deputy CSO and team leader of the Monastery Laboratory in Münster in Germany. And she's one of the leading CROs in the field of skin and hair research. She has over 10 years of experience in skin biology research. She started her bachelor thesis with Professor Ralph Paus. I think we do not need to introduce him. He's one of the great experts in hair research and also the founder of Monastery Laboratory. So Dr. Edelkamp pursued a career in skin and hair follicle biology, and her research interests focus on inflammatory skin and hair disorders, among others, aging and pigmentation of the skin, the immune privilege of hair follicles, hair growth, and hair health. So it is my great pleasure to introduce her to you. Please write your questions in the chat or in the Q&A already during the presentation. Janin, please, the floor is yours.
Okay, thank you. Okay, everything should be set right now. Okay, then thank you very much for the introduction and also for having me today. Within the next 20 minutes, I will try to give an overview on currently available in vitro and ex vivo models for hair research that are most clinically relevant. So in hair follicle research, we have many complex diseases and research questions that we are dealing with. So we actually really need good models to answer all of these questions. So I will try to give an overview what, in my opinion, are the key assays. Of course, I cannot explain all the assays, but I think these are the most clinically relevant. So I want to start off with saying actually and emphasizing the great advantage that we have in dermatological research because we can fairly easily access the skin and the hair follicles that we are interested to work with. Of course, this depends on a good collaboration with clinicians, but I believe, for example, if we compare ourselves to brain research, we really have an advantage there. So we actually have access not only to healthy, but also to diseased hair and skin tissue, and this will help us when we want to identify new targets or therapeutical approaches that we when we put our research questions. And once we have identified these questions and which methods we want to use, we need to select the most appropriate model. So how do we do that? I asked myself a couple of questions. What do I want from a model when I have a research question? And these are just some thoughts. Maybe you have additional ones. So I think it should allow high or medium throughput screening, anyways, be cost effective, reproducible, allow the investigation of cell-targeted responses, mechanistic investigation, but still we want to also be able to customize the model. They should be ethically advantageous compared to animal models, clinically relevant, and also allow us to investigate side effects on the skin when we are manipulating, for example, the hair follicle. We would like to have different administration modes and also maybe potentially already segregate patients for clinical studies by predicting responders or non-responders for certain therapies or approaches. So I will talk today about in vitro and ex vivo models and not cover the in vivo models yet. So let's directly jump into cell-based models. And I would like to start off with the outer root sheet keratinocytes culture that can be basically outgrown from full intact hair follicles. I would characterize this as a medium throughput model because it's also quite laborious to grow out these cells from the hair follicle. And it can help us though to understand some questions when we have asked regarding growth factors that influence hair growth. For example, important allergen prolongation. You see an exemplary study here on modulating the adenosine receptor and how different growth factors were regulated. And this was then later on also confirmed in the hair follicle ex vivo model. So this is definitely something that is relevant. However, if we would like to study hair matrix keratinocyte proliferation, this model wouldn't be so appropriate because these cells are by the nature primed to differentiate and not to proliferate. Another important cell-based model are the hair follicle melanocytes. That was is a model that was developed by Desmond Tobin. These cells are also quite tricky to isolate, but we can use them to study different effects on hair follicle pigmentation. In this case, for example, they were treated with alpha MSH or ACTH, and one could see an increase in melanin production. The next model is the DP fibroblast model. I think this is the most misused model actually in some cases, because Claire Higgins has shown very impressively that these cells usually grow in 3D in the dermal papilla structure in the hair follicle. If you take them out of the hair follicle and put them in 2D culture, they completely change their expression profile and actually become more similar to dermal fibroblasts than to dermal papilla fibroblasts. Luckily, you can put them back in 3D spheroids, and they regain some of their expression properties, and then are suitable models, for example, to study dermal papilla inductivity. However, when I did a quick search on PubMed, the most studies I found on this is actually on proliferation, which I find quite strange, because if you look at the dermal papilla, this is not the compartment that is proliferating in the hair follicle, it's the hair matrix that is then directed by the signals of the dermal papilla. So what we always need to really keep in mind when we work with a cell-based model is which questions are these models actually appropriate to answer. So a study that is quite useful, for example, in these dermal papilla cells is on inductivity. As I said, if we treat with an SFRP1 antagonist, the Wei compound, we could see versican expression increase as well as HGF expression increase and alkaline phosphatase activity. More recently, these cell-based models have also become more complex. So so-called hair follicle organoids have been generated, and these are basically dermal papilla cells that then are embraced by different types of keratinocytes, outer root sheet keratinocytes, hair matrix keratinocytes, or even epidermal keratinocytes, and they recapitulate quite nicely also keratins that are expressed in the hair follicle. So this model allows more to even study already a crosstalk between the hair follicle epithelium and mesenchyme. Lastly, even some more complex models have been published where vascularization was added or melanocytes. So finally, we arrived to the Philpott model, so the hair follicle ex vivo models. And this is quite a good and very popular model because these hair follicles are microdissected out of surgical rest material, for example, as you can see here, from facelift surgeries or from follicular unit extractions. And then mechanically, and very tedious job actually to do this, we can isolate this hair follicle out of the skin, and we have the full mealy organ with different cell types included. So the original model is the one of the amputated hair follicles, which is cut below the bulge, the level of the stem cells of the hair follicle actually. And this is used a lot for hair growth studies because these little tiny mini organs in their organ culture plates grow at a similar rate from day to day than our hair on the scalp do. So this is very nicely comparable than if we treat them with different compounds or drugs. So recently, or within the past years and decades actually already, this model has been further developed into full-length hair follicle organ culture, where we really take out the complete length of the hair follicle from the skin. So means we also have the stem cell compartments. We have can have the sebaceous glands attached, or also the infundibulum of the hair follicle, which is relevant if we look at other diseases where most of the pathogenesis is happening in these areas, like hidradenitis suppurativa or acne. So one characteristic of this model, or one caveat that we have to keep in mind, is that during organ culture, the hair follicles will naturally transition from anagen to catagen phase. So what we can then study are basically effects of compounds on the hair cycle only in the transition phase from anagen to catagen, and to see if these compounds prolong anagen phase or prevent catagen induction. But for that, we needed a specific criteria to differentiate between the hair cycle stages. Luckily, now we have dedicated guidelines at hand that allow us to differentiate between anagen, early catagen, mid and late catagen. So then we can assess whether a drug would be clinically relevant in, for example, reducing hair loss or improve hair growth. So which possible readout parameters and endpoints can be studied in this model? I will only give some examples. There are many, but I want to point a bit towards different readouts that are used and for which claims or also research questions this can be adapted. So the most used one I have seen when also working with people from the cosmetic industry is actually hair shaft production, but there are only few compounds that really promote human hair shaft production ex vivo. One of them is spermidine, which is a cosmeceutical. But if we think about this in a clinical sense, this is not the most meaningful parameter, because we don't want our single hair follicles that we have just to grow longer. We want to experience, or the patients mainly want to experience, a higher hair density. So yeah, simply saying hair growth would mean you just have to see your hairdresser more often, whereas anagen prolongation is the more important parameter if you want to experience a higher hair density on your scalp. So here I come back actually to the whey compound that I have also already shown on the dermal papilla fibroblast, where we saw a higher inductivity, and especially then here this relates in the more complex model to an increase in anagen phase, most likely due to the communication between the dermal papilla fibroblast and hair matrix keratinocytes. Another compound that is also prolonging anagen phase and has recently been published is, for example, the Edelweiss extract. And also here, one can see that the expression of the dermal papilla inductivity marker versican was increased. For this compound and also for Sandalore, this has nicely been correlated with in vivo studies. So basically, this emphasizes the meaningfulness of this model, because this is an effect that can be reproduced in vivo. Another example I would like to give is that also stimulation of hair follicle pigmentation can be studied, not only in pigmented hair follicle, where we see an increased melanin production, but even also repigmentation in gray hair follicles can be observed if a suitable compound is used to stimulate the hair follicles. As I said, there are many more markers or readout parameters, endpoints that can be studied, for example, on stem cells activity and numbers, immune privilege of the hair follicle keratinocytes that would then have an effect on hair shaft quality and hair strength, perifollicular immune cells, autophagy, and so on and so forth. Another way to use this model, which is very important, is actually to challenge it. So if you treat the microdissected hair follicles with a certain drug, cytokine, or cocktail, you can experimentally induce certain conditions and phenotypes that can mimic diseases. For example, we can treat the hair follicle with interferon gamma and thereby induce an immune privilege collapse, which is one of the cardinal features of alopecia areata. Or we can treat with cyclophosphamide, a chemotherapeutic agent that can then mimic chemotherapy-induced alopecia and stem cell depletion in the full-length hair follicle model, or in a more complex cocktail, also epithelial mesenchymal transition in the hair follicle stem cells that is mimicking scarring alopecia. In these assays, then, we can test different drugs or compound in actually a preventive or rescue settings, which is then very advantageous before going to clinical trials. The hair follicle is now also understood to be more important in immunodermatosis, considering the crosstalk between the hair follicle and the immune cells. So models are available now, which are allowed to study co-culture of hair follicles with immune cells. And these cells can either be derived from the blood or from the skin, depending also on the disease pathogenesis that you're interested in. Here you see an example of a co-culture between gamma delta T cells and stressed hair follicles. And in the case of these weakened stressed hair follicles, the co-culture with the gamma delta T cells led to a hair follicle immune privilege collapse, together with the upregulation of danger signals and dystrophy of the hair follicle, so basically mimicking alopecia areata. Furthermore, this model can also be used to study the chemotaxis of the immune cells to the hair follicle, as the hair follicle expresses several chemoattractants like CXCL10, for example. Lastly, on these technical things on this model, what can also be achieved is gene knockdown by siRNA treatment, which is quite impressive, I think, where basically you knock down a gene in a complete mini organ. And this is very helpful for understanding mechanism of action of a drug or a compound or even a certain structure that has been identified. Follicular units obtained not only from healthy donors, but for example, also from androgenetic alopecia patients can be used. And here we have the opportunity to study terminal versus intermediate hair follicles, or effects of drugs or stimulation with different compounds. In this case was testosterone, and totally different hair types. The next model I would like to introduce is the human scalp skin organ culture. So biopsies from scalp skin that was derived from elective surgeries. And one of the biggest advantages that we have here is that we have different modes of application. Whereas in the hair follicle ex vivo organ culture or cell culture, we have only systemic application at hand. We can also perform topical application here or intradermal injection. And what is quite interesting to see is also that we have from these skin biopsies, the hair fibers emerging and growing during the time of the culture. The endpoints otherwise are pretty similar to the hair follicle organ culture. In addition, we can also study the impact of environmental stressors in this model. For example, we can irradiate the skin with UV or use so-called pollution chambers to expose it to particulate matter or anything that you can think of. And on the right-hand side, what is also really important for this model is that we have an impact sebaceous glands. So this even still produces sebum, so we can further address different research questions in this model. The scalp skin is also rich in resident immune cells. So here, if we want to model inflammatory diseases, and we can treat with the right cocktail, also interferon gamma in this case, for example, then induce immune privilege collapse, but we can also even see the infiltration to the hair follicle of the resident immune cells. And then in this case, we use tofacitinib as a drug to show that this effect can be reversed. Briefly, just to say that this model also helps to understand how injected cells behave in the skin. This is interesting in terms of regenerative medicine purposes, so we can label the cells and then track them within the scalp skin. And also this is possible for drugs or compound penetration studies if they are fluorescently labeled, for example. One of the limitations of these models that I have been talking about is, of course, that we take it out from the body and then the skin is not connected to innervation or blood supply anymore. So in order to overcome at least this problem with the innervation, there are now re-innervated skin models available. And we can innervate this model with human iPSC-derived neuronal stem cells. And fibers are generated that actually re-innervate the hair follicle on the same trails of the previously present neurites. And if we characterize this these fibers. They are actually peptidergic nerve that's expressed neuromodulators like PGP or CGRP. So this is not only important to understand the crosstalk between the hair follicle and the nerve fibers, but also if we want to basically analyze questions on irritated or sensitive scalp, if we want to stimulate the neurons. The ultimate model we have in hair follicle disease research is the culture of diseased or affected skin and hair follicles, because this is actually the closest that we can get to understand if a drug or compound would have a clinical relevance. However, we need all the other models as well, as this material is very limited and only allows to have few experimental groups. Like this is definitely not a screenable model. Just want to show a few examples of this model. So here, for example, lichen planopilaris patient biopsies were used and treated with a PPAR gamma modulator, and this showed to improve the number of the keratin 15 positive stem cells and to reduce the immune cell attack in the hair follicle bulge. Whereas on the right-hand side, you can see alopecia lesional versus non-lesional skin that was treated with a certain drug. And then the expression profile of this lesional skin became more similar to the non-lesional skin. So the drug basically reversed this effect. So in this example of hidradenitis suppurativa, I would like to point also how important it is to not only look at lesional skin, but also perilesional skin, because if we are looking at the disease with very advanced lesions like hidradenitis suppurativa, the perilesional skin, which is also pre-inflamed, might give us more answers on responses to drugs, because in these organ culture models, we of course cannot reverse a fistula or a nodule back to normal skin. Yeah, as I said, I wouldn't touch the in vivo models here, but I just want to point that there are also sort of interim models like humanized mouse models for certain diseases where we can, for example, model androgenetic alopecia or use lesional skin of androgenetic alopecia patients in a humanized mouse model, or alopecia areata, that are also very important for research. And if you're interested, I have listed some publications here, but I think this would basically kill the scope of this presentation. So like that, I'm already at the end of my presentation, and I'm looking forward to all your questions to discuss with you.
Thank you very much, Janin, for this great presentation, very clear on all the models, the techniques you have developed to study hair follicle, and all the experimental procedure to resolve questions related to hair disease. So just maybe to start, I have some few questions maybe to start. So is it easy, because you are now doing some research on hidradenitis suppurativa. So is it easy to isolate hair follicle coming from other sides than the scalp? I mean, on the trunk or flexural area or something like that.
So actually, it's very difficult then to isolate the hair follicles from that are not terminal. So the scalp hair follicles are terminal hair follicles that are bigger and also more easily to resect mechanically. So when we really work with these isolated hair follicles, these are mainly coming from the scalp. In the case of hidradenitis suppurativa, we resort to the patient biopsies mainly, or we treat hair follicles with certain cocktails to mimic the disease, because in hidradenitis suppurativa actually is the most complicated case with the nodule and fistula lesions. If you start to manipulate the biopsies that you have all the pus everywhere and so on and so forth. And the structures are so, how you say, they don't have the normal morphology anymore, that it's basically impossible to dissect out the hair follicles.
Okay, so
one option that I didn't mention is if you have also full biopsy and you're interested in a certain hair follicle compartment and you have the hair follicle in the horizontal section, there's also the possibility with laser capture microdissection to then later on from the sections dissect out certain compartments. If you, for example, want to study the infundibulum only of this hair follicles in hidradenitis suppurativa. This could be possible, but really isolating hair follicles from these lesions is impossible. There we have to take the phenocopy models that one has available.
Okay.
Yeah, we have now a question in the Q&A from Vinod Kumar. And the question is, when you culture outer root sheath keratinocytes, don't they change the identity to normal keratinocytes, like the keratinocytes of the skin?
No, they don't, because basically the culture methods have been optimized for them, and you can regularly check over certain passages also the expression of the keratinocytes, the keratines that are relevant for outer root sheath keratinocytes. So this has been done. Of course, it's a limit of passages that you have also with these cells, and the earlier the passages, the better, but they don't change.
I've got another question. So, yeah, in your model, you show that you can get some pigmented hair follicle and showing the pigmentations in the hair follicle. Have you had the chance to look at the melanocyte stem cells coming from the bunch, or?
So we can see melanocyte stem cells in the bulge. We have, especially with staining and also markers, but are you asking whether we have seen migration of these?
Yeah, exactly.
From
is it possible to look at, because there is a melanocyte, I mean the follicular melanocytes, but also the melanocyte stem cells, and is there any possibility to look at the function of these two melanocytes, or?
So I personally have not looked at the one that most likely, if he would have looked at this Desmond Tobin, but what we see, we can see them in the bulge, and also with different double staining see basically what happens to them under treatment, but I didn't see like migration of these cells down to the bulb. Okay. What you can see in the bulb are also the population of melanocytes that are not only in the pigmentary unit, but you can also see the amelanotic melanocytes when you stain, for example, with GP100 in the outer root sheet and in the hair matrix, and characterize if a certain treatment is changing also these numbers, which would be an indication that you're actually also working on the precursors that then make it to the pigmentary unit of the hair follicle.
Okay, cool.
I wonder a little bit about the variation, because reproducibility is something that you mentioned in the beginning, that the ideal model system is reproducible. And there are basically two factors there. One is the inter-individual variability, which can, of course, be dependent on the sex, the age, the ethnicity, and so on. And the other thing is the intra-individual variability. You have talked about different sites, but for example, in the scalp, does it matter where you take the biopsies from and how many replicates you use?
So first of all, for normal hair follicle organ culture, these facelift samples often come from the occipital region, and that's also where we get the hair follicles from the follicular unit extracts. And already if they come from the same scalp location, you have interfollicular differences, because they are small mini organs and none is like the other, but you need to have, of course, sample sizes that allow you to have group sizes of a meaningful number. No? We would never start below 5, and actually that's 5 hair follicles per group is already a bit less. And then also this is when we work with people that have worked with cells before, they are always amazed like how much inter-donor variability there are. Of course, there is a lot, and you can try to stratify your patients or your healthy volunteers that you use. If you use only male between 20 and 30, of course, you have less variability if you check male and female. Also, if you look at something that's influenced by hormones, you will see differences between male and female. But this is something, again, when we formulate our research question, we have to ask ourselves, what are we looking at? What are the right samples or the right donors that we can use? And then we need to expect some variability. So I have also seen that when you have a compound, 2 donors respond, the other doesn't. But this gives us actually already an idea also what will be the clinical reality. No? So, and the same with the patients. If you have a disease like alopecia areata, you have, first of all, acute versus chronic patients, but within the chronic patients, you have patients that have the disease for 20 years and some that have the disease for 5 years. So these are all things that need to be considered. And then this will depend on how big your sample size should be for your study. But definitely you wouldn't look at only one patient.
Sure.
But it's very good to be aware of this already from the beginning.
We have another question. So it's what percentage of dermal papilla cells remain the same when you culture them using spheroid 3D model? Do you see any changes of DP cells to fibroblast in 3D model? You can read it also.
Wait, to check the chat.
In the Q&A.
Q&A, sorry. I cannot give you percentages on this because this is not my main focus of research. I don't know if this has been really quantified from the spheroids, but I would expect as long as they keep in their 3D environment, they keep their dermal papilla identity. I wouldn't expect that there is a part that becomes more like dermal fibroblast than the others. But I don't know on this for sure, to be sure.
Okay, I have a question on the stem cells. So the hair follicle stem cells, how do you define them? And you mentioned also the chemotherapeutics. How is the effect of chemotherapeutics on the stem cells?
So in the hair follicle, there are different markers that are defined for stem cell, and the one that is mainly used is the cytokeratin 15. As far as I know, there is not a clear functional relationship why this keratin 15 is basically the stem cell marker, but it has been characterized as a dependable marker in the human hair follicle. There are differences with the mice, and if we treat, for example, with chemotherapeutic agents, we can really see an increased apoptosis of the stem cells. For the scarring alopecia, we would then see this epithelial mesenchymal transition. And basically, if you treat, in the hair follicle organ culture, you don't treat so many cycles that you would see a depletion of stem cells. You would only see the initial apoptosis induction.
Thank you very much. I think it's time to conclude. Thank you for this presentation. It's a whole new word. And it was great to get a glimpse into it.
Yeah.
And for the audience, it will also be available on YouTube later. So thank you. And I hope to see you all next week already in Amsterdam on the ESDR meeting. And I would also like to remind you of the next episode of ESDR Kitchen, which is on the 19th of October, when we can listen to Erwin Schachler about the epidermis, a battleground for inflammatory skin diseases. Thank you all for listening. And thank you, Janin, for the fantastic presentation.
Thank you, Janin.
Yeah, you're welcome. Thank you for attending.